Welcome, everyone, to the joint Immunize Canada and CANVax webinar series. Immunize Canada is collaborating with the CANVax project to host a four-part webinar series on the topic of immunizations during the SARS-CoV-2 pandemic. The objectives of this webinar are to understand the importance of maintaining immunizations throughout the life course during a pandemic, to identify best practices and strategies for safely coordinating and delivering immunization programs during a pandemic, and to describe the impact during a pandemic. To learn more about our upcoming webinars, please visit our website at canvax.ca as indicated in the link you see on the screen. Before we begin, we would like to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. Immunize Canada and CPHA are committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. We would also like to express our deepest gratitude to all the frontline essential workers dealing with the COVID-19 pandemic. Thank you all for your hard work in keeping us safe during this time. Today's webinar, School Immunization in Canada During the COVID-19 Pandemic, is brought to you by Immunize Canada and hosted by the CANVax project. This webinar series has been made possible from an unrestricted educational grant from Merrick, Pfizer. Immunize Canada appreciates the financial support it receives from its sponsor members. All financial support, including educational grants, is used to cover the development of educational materials and campaigns. Immunize Canada retains editorial control over all aspects of these materials. Please visit Immunize Canada's ethical guidelines for sponsorship at immunize.ca. I'm Antonella Pucci, CANVax Project Officer with CPHA, and I will be the moderator for this webinar. Assisting me on this webinar is my colleague Ruchan Zhu, who is also a Project Officer for CANVax. As for a bit of housekeeping before we begin, it should be noted that all attendees are muted. However, the toolbar located at the bottom or top of your screen offers you a few interactive features. For this webinar, we'll be doing things a little bit different than from previous ones, as we'll be using both the chat and Q&A feature throughout the presentation. At the end of today's presentation, there will be an open forum discussion to ask your questions or to comment on the webinar. Please type them in the Q&A box, and also ensure that your chat feature is set to everyone, as shown in the image, so that everyone can see your comments and questions. If you would like to ask questions anonymously or inform us of any technical difficulties, please type them in the Q&A window. If multiple people are experiencing the same technical difficulty, we will address it live. You can use both the chat and Q&A feature at any point during this webinar. We'll do our best to address all questions asked, but if we happen to run out of time, please feel free to email us your questions and we'll share them with Dr. MacDonald. As a reminder, when asking a question through the Q&A feature, the question is first read out loud, answered live by the presenter, and then posted in the all questions section. We strongly encourage attendee participation throughout the presentation, and we look forward to hearing your thoughts and questions. Finally, as for just some quick notes, the webinar is being recorded and will be made available on Immunize Canada's YouTube channel and on canvax.ca a few days after the end of this presentation. Also, after the end of this webinar, you'll be invited to take a short 5-minute survey. We strongly encourage you to take this survey to provide your feedback so that we can assess your satisfaction and identify areas for improvement in the delivery of this webinar series. We take all suggestions into consideration, and we really do appreciate the time you take to fill out the survey. So with all that, let's begin. I'd like to introduce our speaker for today's webinar, Dr. Shannon MacDonald. Dr. Shannon MacDonald is an assistant professor in the Faculty of Nursing and an adjunct in the School of Public Health at the University of Alberta. Her program of research focuses on developing evidence to support immunization best practices, programs, and policy, and to promote informed decision-making by parents. Her passion is working directly with policy advisors and clinicians on research that informs their immunization policy and practice decisions. Dr. MacDonald was recently awarded a grant from the Canadian Institutes of Health Research entitled Vaccination in a Pandemic: The Impact on Routine Vaccinations and Future COVID-19 Vaccine Acceptance. This project involves researchers, clinicians, and policy advisors from across Canada with the aim of informing national and provincial and territorial pandemic immunization strategies. So with that being said, I'd like to turn it over to Dr. MacDonald. So whenever you're ready, you can start sharing your slides.
All right, well, thank you very much for the invitation to present today. I'm speaking to you today from the University of Alberta, which is located on the beautiful First Nations Treaty 6 territory and Métis Region 4. And it's a beautiful, still summer, sunny day here in Alberta. So yes, I appreciate the chance to speak to you all, and I'm thrilled to see how many people have logged on. And as I was saying to Rutian and Antonella earlier, many of you are absolute experts in this field of school immunization. Others are just interested, and I'm hoping I'll be able to share things that are of interest to both of you. So just a couple of disclosures first. I do hold research funding from national and provincial research funding bodies and public health agencies. And I think a key disclosure is to state my bias, which is that I am a pediatric nurse and a public health epidemiologist, and I have a very strong bias in favor of immunizations. Just to let you know a bit about the information that I'm going to share with you. So there's a couple of key NACI guidance documents with which I've provided the references to at the end. One of them on continuity of routine immunizations during the pandemic, and then another one that's available on influenza vaccination during the pandemic, which is probably a great resource for everybody. So those are listed on a slide at the end, and when you get the slides, you'll be able to go find that. The other source of information is from this ongoing project that Antonella mentioned. So this was funded by the CIHR in their COVID-19 Rapid Research Funding Opportunity. And I want to just provide a quick overview of who's involved in that project, because we have the benefit of some excellent colleagues and team members. The co-PI Arnaud, and then we have representation from across, almost entirely across the country, as far east as Nova Scotia and all the way to British Columbia. And key members of this team are our knowledge users. So the National Advisory Committee on Immunization are principal knowledge users on this project, and then representation from 3 provincial health departments. So that's been great in terms of making sure that we're investigating something that end users actually are interested in. So what I plan to cover today is to answer these 3 key questions from across Canada perspective. So what has been the impact of the COVID-19 pandemic on school vaccine delivery and uptake? What is being done to complete interrupted vaccine schedules? And what are the plans to deliver school immunization programs in the coming year? And I've left a lot of time at the end because I'm really interested in having a bit of a forum for participants to share their current challenges and ideas to overcome them. I'm hoping it'll be quite interactive and not a case of just, you ask, I answer, because I think we have a lot of expertise online today, and I think there's information we can share amongst ourselves. So at the end of the presentation, I'll open up the chat box, and I'll address comments in the chat box, and the team from CANVax will be keeping an eye on the Q&A box as well for me. I'm not multi-talented enough to monitor 2 at the same time. Okay, so the timeline, which I'm sure we all are well aware of, but just to set context. So of course, the COVID-19 epidemic started in China. It's hard to believe it was only this past December. It seems like a lifetime ago at this point. In March, on March 11th, the WHO declared it a pandemic, and very shortly thereafter, most schools in Canada closed. So the first question I'll cover is, what has been the impact of the pandemic on school vaccine delivery and uptake? So first, I'd like to talk a bit more broadly about school immunization programs in Canada, as everyone online may not be intimately familiar with it. So listed here are some of the most common vaccines provided in school-based programs in Canada. There's the HPV vaccine, the hepatitis B vaccine. Both of these are 2 to 3 doses, so most kids would have gotten their first dose in the fall and may or may not have gotten their second dose in the winter or spring. Meningococcal conjugate, the quadrivalent vaccine, is administered as a single dose. Tetanus, diphtheria, acellular pertussis booster is provided. And then varicella is provided in some provinces as a catch-up program for kids who didn't receive their second dose in infancy or preschool. For those of you that aren't familiar with how school vaccine programs work in Canada, the usual model is that it's delivered by public health, and public health nurses go into the schools to deliver the programs. There is some option for clinic-based delivery if a child has, needle fears or anxiety, and the school-based setting is not the ideal for them. School-based delivery has been shown over and over again to be a very efficient way to reach the majority of children in the necessary age groups and to reduce disparities in access. So for instance, it's been shown that when there's the option of school delivery or delivery in a public health clinic, that children with more socioeconomic disadvantage are more likely to get vaccinated in school. And they're less likely to receive the vaccine if they only have access at the public health clinic. So it's really critically important. It's a critically important part of routine immunization programs in Canada. As you can see from this map, there's quite a bit of variability across Canada regarding what grades these vaccines are provided in, but most are between grades 6, 7, 8, 9, which would be around ages 11 to 14 years, with some provinces and territories providing vaccines a bit earlier, such as in grade 4 when children are around 9 years old. And this seems to be a constantly moving target, this patchwork of vaccine programs. So what happened to these programs when COVID caused schools to be shut down? Well, obviously, school-based programs ground to a halt across the provinces and territories in March. Vaccine doses scheduled for the spring term were missed. One example from my home province of Alberta, we had about 50,000 grade 6 students who would have missed their second dose of HPV and hepatitis B, and the grade 9 students would have missed their quadrivalent meningococcal vaccine. There may have been some exceptions where some schools were a bit ahead of schedule, but the vast majority of kids would have missed those doses. And it's probably a fairly similar scenario across the country. So what are the implications of these missed doses? So again, coming back to this list of the typical vaccines that are provided in schools, HPV, as I mentioned, is typically a 2-dose schedule, and 1 dose results in lower vaccine effectiveness than if the child got 2 doses with the appropriate interval. Hepatitis B also is typically 2-dose schedule provided in the schools, and 1 dose would have not provided the same level of protective antibodies as the 2-dose schedule. For the quadrivalent meningococcal vaccine, this is the only dose that's provided for this vaccine. The meningococcal vaccine provided in infancy is just a meningococcal C vaccine. So if kids miss this dose, they're vulnerable to a number of strains of meningococcus during a very high-risk period of adolescence and young adulthood. The Tdap vaccine it's 1 dose that's scheduled in school usually, and this is a booster. Most kids would have received their last dose in preschool, and we know that particularly the acellular pertussis tends to wane over the years. So if they miss this dose, they potentially are heading into adulthood without a booster for tetanus or pertussis. And last, the varicella. So this is the catch-up dose for those who miss their second dose in preschool, and it's needed both to prevent primary vaccine failure as well as secondary vaccine failure or waning immunity. So those were the implications of missing the dose outright, but the question is, are there implications of interrupting the series? So a delay between doses. NACI and all the provincial territorial guidelines are very clear that interruptions in any of these vaccine series do not require them to be restarted. So you can just pick up where you left off. You don't have to go back and redose from the beginning. Interestingly, for HPV, there's actually evidence that 0 and 12-month schedule may result in a stronger immunogenic response than a 0 and 6 month schedule, which is what we typically use in a school program. So there really is no disadvantage to kids that get their second dose later than planned. So if they got their first dose in fall of 2019 and they're getting their second dose in fall of 2020, they're still in good shape. Hepatitis B, again, the series doesn't need to be restarted, but of course, longer term immunity isn't going to be obtained until the last dose is administered. The next 3 vaccines are the ones where it's usually only 1 dose provided, so it's more a matter of getting the 1 dose delivered as opposed to a series. So with varicella, again, this is a second catch-up dose, and so kids that only got 1 dose and there's a delay or interruption in this vaccine series, they're vulnerable to varicella until they receive. Some of them are vulnerable to varicella until they receive that second dose. So the question of how big an impact COVID has had on vaccine uptake and coverage levels is yet to be seen. Clearly, it's had an immediate impact on coverage levels. That's sort of, you know, we know that intuitively as well as anecdotally. But the question is really whether we'll be able to catch up kids to the target coverage levels. And that's some work that our team is going to be engaged in. So there's 3 provinces on our team who are partnering on our grant, in which we're going to look at what the vaccine coverage level has been like in the schools, and we'll follow that over the coming year to see how good we're doing at catching up kids who miss doses. And that'll be really critical, I think, in terms of informing public health about whether additional measures are needed to make sure that we catch these kids up. So the next question is, what is being done to complete vaccine series that were interrupted by school closures? First, let's look at the guidance from NACI, and then we'll look at what the different provinces and territories have been doing. So according to the NACI guidelines on continuity of routine vaccines during the pandemic, routine adolescent vaccines like HPV and Hep B didn't need to be prioritized over the summer. They said it's fine if you defer them until schools open because endemic rates are quite low, and it was more important to prioritize the infant schedules. NACI also states that when school-based immunization programs are restarted, students can initiate or complete their series at that time. And just to re-emphasize that restarting a series is never necessary for routine immunizations. A really important point, I think, for provinces and territories to think about is this point, which is that eligibility criteria should ensure that students who missed immunizations due to school closures remain eligible for the recommended vaccines. So for instance, if a provincial or territorial guideline says that adolescents are eligible for HPV vaccine until they graduate from grade 12, but they missed the second dose and have now graduated, eligibility rules should allow for completion of the series. And the last point from the NACI guidelines I wanted to highlight is that if doses have been missed or deferred, a reminder, a recall really should be in place to ensure that the student and the parent are aware that the child needs to receive the immunizations when full healthcare or schools resume. Most parents are likely not even aware that their child missed a vaccine dose when schools closed. I mean, if they're anything like me, they were too busy worrying about getting their kids connected to online schooling in the spring while still trying to figure out how to juggle all their other responsibilities. So I think there's an important role for public health there in reminding them that this dose was missed and communicating the message about its importance. In addition to the NACI guidelines, there's also a great article that was published in the Canadian Journal of Public Health last month. It was authored by Noni MacDonald, Jeanette Kumo, Ev Dubé, and Lucy Bucci from Immunize Canada. And they highlight the fact that more resources are going to be needed in this coming year due to the fact that we're basically going to have a double cohort of students that need to be immunized. And because there'll be additional measures that are required to limit potential COVID-19 transmission during immunization programs. They also have some great suggestions about provinces and territories getting creative about opportunities for immunizations, such as standing orders for immunizations when patients come in contact anywhere in the healthcare system, so whether they're visiting an emergency department or their family doctor. They also suggest that pharmacies could help catch up vaccines and deliver school vaccines if the types of immunizations and the age groups are in the scope of practice. And they also suggest special catch-up clinics, of course, with consideration for how to best organize them to increase attendance but minimize risk of COVID transmission. And I've provided a reference to that article in my reference list. So that was the NACI guidelines. Now from our ongoing study, we can report on what's been happening with school immunization catch up. So far we have data from 7 provinces and territories. So what we've been doing is contacting public health in the different provinces and territories and doing interviews with key informants both at the provincial level and as well as some regional levels so that we can get a bit of a perspective both on province-wide approaches as well as innovative regional approaches, both for large urban centers and for more rural areas. And so we're about midway through that process. So I have data from 7 provinces or territories about what went on there between March and August of this year. And so as you can see here, in 2 provinces or territories, they decided not to have summer catch-up programs, whereas 4 provinces and territories did go ahead with catch-up programs in some regions of the province, and 1 province we spoke to had summer catch-up programs province-wide. So there's quite a diversity of whether catch-up programs went on over the summer. In terms of where those catch-up programs happened, some provinces were encouraging primary care providers to immunize kids, and others were offering immunizations through public health, either at schools or in other local facilities, whether the public health center or community centers or whatnot. So for instance, in British Columbia, they sent out a letter to parents to give them locations and times and dates where they could come to have their kids' vaccines caught up. We've also heard from Immunize Canada, who had done a little bit of digging as well about this topic. And they've found that some provinces and territories were using some really innovative approaches like drive-through clinics, mobile health vans, and using community health centers or churches. So that was the summer. Now heading into the fall, what will happen with school immunization catch-up? So this is catching up from last year's missed vaccines. And a bit of a mixture again. So some provinces and territories are planning to offer catch-ups through the regular school-based program, just piggybacking on their annual programs. Or they are offering to catch up immunizations outside the school-based programs, such as at community facilities or public health clinics. And one of the provinces we talked to has not yet decided how they're going to proceed. I'll be curious in the discussion later to see if there's other innovative approaches that people are using. So that's catch up from last year. Of course, we're heading into the new fall semester, and we wanted to look at what are the plans for delivery of school immunization programs in the coming school year. So first of all, whether catch-up or routine immunization is being done, we of course need steps in place to minimize risk of transmitting COVID. And NACI has provided some guidance on this, both through their guidance document about routine vaccines, as well as the document about fall influenza program rollout. Whether they're being provided in school or off-site, they recommend personal protective equipment for healthcare providers. Specifically, so in the influenza guidance document, they explicitly state that vaccinators should wear a medical mask and eye protection, as should other staff who are not able to maintain a 2-meter physical distance. So if there's people assisting with, getting the kids, lined up and into the room for their vaccinations, they should also wear PPE. They recommend wearing of non-medical masks by clients, physical distancing, so things like managing lineups at the schools or seating in the waiting areas. They talk about scheduling considerations. So a lot of you are doing this already in public health clinics, spacing out appointments, calling from the car before entering the physician's office or the public health clinic. In schools, probably a good approach here is, kids are, in most schools, are using a cohort approach. So moving kids through the immunization clinic or the immunization school site in their school cohort would probably be a good approach. Children, of course, should undertake health pre-screening before immunizations. Now, most schools would be requiring this for attendance at school, so kids shouldn't be at school if symptomatic. So it's just a question of whether or not the screening should be done again or not, and that's a decision that will need to be made. And of course, if immunizations are being provided in clinic settings, then they should be deferred for symptomatic individuals. If, for instance, a physician is immunizing in their clinic, they might want to separate their well and sick patient visits. So have, well patient visits in the morning, sick patient in the afternoon, that sort of approach. So that's the guidelines from NACI. So what did we hear from the provinces and territories we interviewed about their plans? So at the point we were doing the interviews, we started those in August, many of the schools hadn't finalized or announced their plans for the coming school year. Many of them are waiting to hear back from the schools before deciding on the location for delivery. Many think the plan is going to be to continue school-based delivery if possible, with, of course, adaptations for COVID restrictions. We did hear some schools in large metropolitan areas have said they may refuse to allow school-based immunizations. They're feeling so overwhelmed with coordinating COVID-19 safety measures in the school that they feel like it's one more thing that they can't do. It's understandable, but it's really concerning given what we know about how good school programs are at providing equitable access to vaccines. Some provinces and territories may move to community-based delivery by appointment. And there's also there was some talk about releasing school-based vaccines in small quantities to healthcare providers who don't typically provide the school-age vaccines. So those are some of the ideas that the provinces and territories are exploring. In the interviews, participants were speculating about what COVID measures would be in place, but most didn't know the specific plans for these yet. But here's some of the things they mentioned, and as you'll see, a lot of them overlap with the NACI recommendations with little variation. So of course, health pre-screening questions, physical distancing, and PPE by immunizers. Wearing of medical or non-medical masks by clients. So the NACI guideline says non-medical masks are recommended, but we've heard from at least one province that they're using medical masks in the childhood programs. So it's possible that some provinces may require this in the school programs as well. So that would require them to be able to provide medical masks to kids if they decide to take that step. Other things that our participants mentioned were, using larger facilities or spaces. So rather than, using a classroom, maybe using the gymnasium so they could spread things out, having separate entrances and exits, having good ventilation and airflow, which might work okay for, doses delivered in October. For those of you that live in places like Edmonton in February, having the doors open and the windows open is a bit more of a problem. So that'll be something that we have to figure out. And then the other thing they mentioned is having appointments if it's in a clinic setting to minimize crowds. So why are we worrying about school vaccines in the middle of the pandemic? Obviously, this is a really complex process, and some people might say, gosh, that's a lot of hassle to go through. Why don't we just park school and routine vaccine programs until we've got this pandemic under control? Well, it's an easy question to answer for those of us that have seen the impact of, for instance, a teenager with meningitis or a young woman with an HPV-related cervical cancer. Meningococcal infection, of course, is very serious and life-threatening. for every 100 people who get sick, up to 15 of them will die even with treatment. And that's, not even counting the permanent complications of a meningitis case. HPV vaccine, of course, protects against HPV-related cancers of the cervix, the vagina, anal and penile cancers. So, they're not minor issues. Of course, once COVID-19 public health measures begin to be relaxed, and eventually when international borders are reopened, the risk for vaccine-preventable disease may increase as people start to travel and congregate again. Not only is it important to reduce outbreaks for the health of the public, but also because of the impact it can have on the healthcare system, which is already, potentially overburdened as a result of COVID. And the last thing we need is to have an outbreak of a vaccine-preventable disease. So a lot of us know that, but the general public and even many policymakers may need to be reminded about this. And so I thought it was really apt in the article by Noni MacDonald and her colleagues, where they clearly state that communicating why routine immunization, including adolescent vaccines and influenza vaccine, is so important now during this pandemic is really critical. But we have to be mindful that given the wave after wave of public health messages around COVID that are going out, we need to really be strategic about the message about routine immunizations getting through, and that it's not just, one more thing in the news cycle. And it's also really important they highlight that public concerns about vaccines really need to be heard and addressed. We all know there's a lot floating around out there on social media around vaccines, and we don't want this to be one more reason why people turn their back on routine immunizations. So we need to be ready to listen to and address concerns about the currently available vaccines, but also about future COVID vaccines. So clearly, those of us in the public health sphere have a big job ahead of us. So that's the end of the formal presentation. I want to just take the opportunity to thank CANVax and Immunize Canada for the opportunity to present, and to thank members of my team who really helped me with the PowerPoint I shared with you today. And I just wanted to provide my contact information in case you want to reach out at any point. As I mentioned, the references are there, and I'll be providing the slides as well as the recording being posted. So if any of those are of interest to you. And then I'd love to move on to opening the floor to questions. I'd love this to be more of an interactive piece. I know it's a bit challenging when it's in a chat box versus in person or verbally, but I'd love to hear any insights you have on how we can better provide school-based vaccines during this pandemic. As I mentioned, many of you are experts in this in your respective provinces and territories. It'd be great to hear what are your challenges you're having, what are the strategies that you've thought of for overcoming those challenges, and if there's a way for us to share information, I think that would be great.
Awesome. And while you're opening up the chat box, we just want to thank you again for your presentation. And we actually have 2 questions in the Q&A. Shannon, I don't know if you mind answering those first before we get to the chat box.
Go ahead.
So the first question that we have in the Q&A box are if there are any studies on HPV being given more than 12 months spacing and effectiveness.
So it's interesting you should mention that, because I was just doing a little additional digging this morning, because in Quebec, I know they're proposing to deliver the second dose of HPV, I think it's 5 years later. So they've recently posted on their immunization website that kids who missed the second dose, and anyone from Quebec, feel free to correct me if I've got this wrong, but kids that missed their second dose of HPV will be provided it in a later school year. And I'm not aware of what the body of evidence is for that. The clinical trials data that I looked at so far, what I've seen, report on a 6-month interval and a 12-month interval, and do highlight that longer 12-month interval has greater effectiveness. But if there's others who have insight on that, I'd welcome it.
Awesome. So I'm just going to get to another question that was asked in the Q&A, and then you can also just review what is happening in the chat box, and we'll go back to the Q&A. So it's evenly dispersed. So another person has a question of PPE for immunizers. Is it necessary to wear a gown, which must then be changed after each client seen?
So the recommendation from NACI doesn't include wearing a gown unless the immunizations happen to be provided during a clinical encounter that, you know, like say the person's come in for some other reason and they're providing immunizations. But if it's purely an immunization appointment, they don't say that a gown is required.
Okay.
So shall I have a look at this chat box and see what we've got here? So the first one I see, and I've asked Antonella and Rutian to help me if I miss any, but I'll get started. So one question here is, many parents are not aware of measures or plans put in place for vaccination programs. Do you know if provinces and territories will be announcing publicly their plans shortly? I guess the short answer is no, I don't know. Even, you know, we've been doing interviews as recently as this past week, and some of the provinces and territories haven't decided and or released their plans. In some provinces, like for instance in Alberta, we have, you know, there's the policy level and then there's the implementation level. And Alberta Health Services usually has a fairly unified approach across the province, but it's also possible in other provinces where different regions have different plans. So yeah, the short answer is we don't know when the different provinces, territories, and or regions will announce, but I think it's important that in a time when parents are experiencing so much anxiety and uncertainty, it certainly would be nice for them to know what the plan is. And so, you know, communicating that will be important. Oh, somebody's asking if I can post my contact information in the chat box. I will do that. I'll keep going with the questions for now, but I can.
Yeah,
or maybe
just on that point that has been shared already in a lower response.
Okay, perfect. Oh, comment. Oh, I see Noni is present today. Excellent. So one of the real areas of concern on school dropouts and how we will find them. We know they end up in vulnerable subgroups, so being able to get them caught up in school is key. Did any provinces discuss how they're going to know who was missed, especially if dropped out when the school year started this year? So no, none of the provinces yet have mentioned that. One thing they have talked about is the fact that, you know, in some provinces and territories, kids aren't physically back in school. So, you know, these plans for how to deliver school vaccines are great, but if a third of your student population, or in some cases, your entire school population are online, then it's a question of how are you going to provide it. So I think the key there, Noni, is going to be about documentation and communication. And I mean, we have this recurring conversation about immunization registries, and, you know, first of all, we need them, and second of all, once we have them, how can we use them to improve service delivery? So it's one thing to have them and say, yeah, we've got it, but if providers can't access them and they can't use them to identify who didn't get their dose, or a challenge certainly I know that that goes on is if school registries and health registries aren't linked, then the health side doesn't know which kids didn't come back to school, and so they don't know then which kids need to be targeted for programs outside of school. Because you're very right, kids that aren't returning to school and are in some, you know, vulnerable situations are not kids we want to just write off and say, oh well, I guess we won't immunize them. So next comment from Michelle Johnson. There's some current issues scheduling vaccines at Haturian schools, as some outbreaks there have closed some schools on colonies. Yes, I I'd be curious if, and you know, Rutiana and Antonella, I don't know if you want to skip ahead and see if anybody has any insight on that. That's something I'd be interested in. I know there's been some interesting things. I was just following it on Twitter about Mennonite communities and their limited use of technology, and so how do they get information out to parents when they don't have radios and TVs and things like that in the home. In Quebec, they've decided to only give 1 dose of HPV. It will be given in fourth grade and second dose in grade 9. I get confused about the grades in Quebec, I'll be honest. Because there's the secondary grades and the elementary grades, but yeah, that was my understanding as well. So I think Francois is filling us in that it is going to be 5 years in between the first and second dose. And I think it'd be great, Francois, if you have any literature on that, because there's one of the audience who was interested in what the evidence is around that. Next question, I would like to hear reasons why residents are vaccine resistant. Do you meet with vaccine resistant persons and healthcare providers to address? So I'm not sure if this is like a broad question about vaccine resistance. I mean, the school in Alberta, the school nurses do an exceptional job of following up with families to do that. In other provinces where it's physician delivery, the physicians are dealing with that one-on-one in their clinics. I maybe won't get into all the various reasons around, you know, vaccine resistance, but I think one key thing to point is that the vast majority of parents are vaccine accepting, and it's often access barriers that are the challenge. It's not that they don't want to get vaccinated. It's that if I have to take time off work to get my kid to the clinic because they can't get it in school, then I'm sorry, I need to get food on the table, not take time off work. So I think a key strategy is removing access barriers, and then additional strategies around counseling vaccine hesitant parents. Oh yeah, so Francois just clarified about the grade 4 and grade 9. In primary care, we don't mind in our clinic giving childhood immunizations in our nursing clinics. So different settings where that can happen. Some schools in Manitoba are initially stopping us from coming into the schools this fall. Oh, that's sorry to hear that. Usually due to being nervous what the school division directives are, and also related to space in the school now that children are more spread out. I did find that once I explained the reasons the vaccine school program remains important and that we're willing to be flexible in the specifics, they understood and were willing to work with me. So that's great to hear, Marlene, and hopefully other provinces where this has been a challenge will be able to have those same conversations. I think the relationships that public health has with the schools are going to be key here, because reassurances and flexibility and creativity is going to be absolutely the name of the game. Let's see. Do you know if Alberta is considering having kids switch to medical masks? Observations would definitely support that many non-medical masks are not being cleaned properly, if at all. Yeah, that's a good question. My kids both went back to school last week, and you know, because I'm a nurse and I've been walking them to school and sort of checking everybody out, who's wearing their mask, how are they wearing their masks. At the end of the day, are they taking them off properly? Are they cleaning their hands after they take them off? I don't know if there's plans afoot to do that, but I can see if you know, if it becomes a problem and we start having cases, looking at masks and whether kids are wearing the same masks day in, day out, versus providing them a new mask at the door every morning might be a strategy, an expensive strategy. Another concern regarding school vaccines is higher rate of absent students and online schooling. Absolutely. So I think we don't really have, if anyone has ideas, I don't think we've really nailed down a strategy for the online schooling kids. Again, I think documentation and using linkage of health and education Databases is going to be important to know who is online, and so needs to be targeted with a phone call or a letter home to say, make an appointment and come into your local health center or physician. Comment here from Nicole in Alberta. I'm a school-based immunization public health nurse in Alberta. I haven't felt part of the plan in how our program will be responding and supporting the school-based programs. Attending today has provided me with more information than what's been provided so far. I think it's important that the public health frontline nurses are kept in the loop on some of the planning measures, and we're directly connected with our school communities and may have insight on how our communities approach scheduling and spaces. I'm particularly concerned how we will meet the immunization needs of the students who are attending school online. So anybody who's listening from Alberta who has who's on that planning committee, I guess the message is the public health nurses who are out there with relationships with the school want to be involved. Let's see.
Shannon, just to interrupt here, there's a few questions on the Q&A side as well, so I'm going to ask them as well.
Sure, go for it.
So the first one is, with a mix of in-person and distance learning, we're finding that we need to consider a mixed method of reaching students since they won't be attending school. Did any of the areas you contacted have different plans for reaching these different student groups?
So far, no. And in retrospect, I wish we had explicitly asked. I'm pretty sure in our interview guide, we didn't explicitly say, what are your plans for in-person? What are your plans for online? So unfortunately, we don't have that information for the provinces we've talked to already, but maybe we can slip that question in for the ones that are we have yet to talk to. Of course, doesn't help you here today, sorry.
And so going back to the ventilation requirements or recommendations, if mass clinics were to be hosted in arenas and in colder months, as temperatures get colder, what are the recommendations for use of floor heaters and its IPAC concerns with circulating air? Note, if all clients and staff in the space will be masked, are there any concerns?
I have to say that would be beyond my level of expertise. So I think somebody with expertise more around environmental health and airflow would probably be a better person to. So I'm afraid I don't know the answer to that one.
And we have quite a few over here. So I'm gonna finish this and now we'll go back to the chat. But
sure.
In terms of post-injection timing, are the 15-minute wait post-injection still in place at this time? We're thinking about crowd gathering, social distancing issues with this time requirement.
Yeah, that's a really good point. And some of the documents from NACI talk a bit about this, and certainly some of these more innovative approaches to delivery come with a question about how to do that 15-minute follow-up. So if you're doing a drive-through, how do you make sure that people don't drive through and drive away? If you're trying to minimize the number of people in the space, do you leave people sitting there for 15 minutes and then you can't move on to the next client? Or is there another way? So I think we're going to have to, when we think about settings for providing the vaccine, so let's say it's in a school, perhaps we need to have like one room where the immunization is happening, a separate space where the 15 minutes is being waited out. For some of the strategies, I mean, it's probably similar things that public health has had to deal with when they deliver vaccines in the malls, right? So you vaccinate somebody in a mall. How do you make sure that they don't wander off to the bay or to the food court before they've waited out the 15 minutes? So I think communication is going to be key, and some strategic planning.
So we have a couple more questions in the Q&A. Mm-hmm. We're trying to just kind of like divide it evenly.
Go for it.
So actually there's another question. Would you provide us with the name of the research article, the one you were mentioning, and the 12-month schedule? The 12-month schedule had immunogenic responses.
Okay, that, I can't remember if it's in my reference list. I'll have to check. That was actually the, Yeah, I think it's in my reference list. I'm trying to remember. I looked at both the drug insert, and then I also looked at, there's a systematic review that was done by Marc Brisson and a team that looked at HPV vaccination and number of doses. And then the other one was the Gardasil 9 drug insert. So those are the two places that had that information. And those are in the reference list.
Okay, great. So the next question is, should public health nurses entering school be considered an essential visitor? If so, are you aware of the general practices across the nation? RE discussions with ministries of education and Ministry of Health and advocacy to continue providing the school-based immunization, the school-based programs in schools.
Sorry, for some reason you cut out for like the first 2 sentences of that.
Okay,
so I caught the tail end, but.
All right, so let's
just
start
the
from
first
there
two,
then.
the first 2 sentences.
Okay, should public health nurses entering school be considered an essential visitor? If so, are you aware of the general practices across the nation?
So certainly immunization is being considered an essential health service. So I think both federally and provincially that's been made clear. It's not an optional, it's not like a nice to have, it's an essential health service. So, you know, it kind of depends on the type of governance in a particular province or territory, whether or not the province can say, you know, look, public health is an essential visitor and this is an essential service, so schools just have to make this happen. That might work in some provinces. In others, it's up to the school board. So you might have, you know, public school board, separate school board, you know, chapter schools or whatnot. So and then it might even get down to the school level. So I think it's really going to depend. I mean, I tend to be of the mindset that if we can centralize things to a certain degree, like if it's possible for the province to do that, that would be great. But we also have to be mindful of being flexible. You don't want to completely alienate a relationship with a particular school, because, you know, if you don't have trust between public health and the schools, that's no good either. So it's finding the balance between like a central edict versus like local level partnerships.
All right, so in Ontario, public health units use a database called Panorama for maintaining updated immunization records. Parents, guardians can access and report updated immunizations their child has received through a secure web portal to this database. However, healthcare providers do not have access, nor can they report directly to the database. This is extremely inefficient and ineffective. Do you know if there are any plans for a national database?
We could dream. I think, you know, it's literally been decades of this battle. And I think we've all come to the realization we're never going to have one national database. The best really that we can hope for is linked regional databases. So that, you know, if there's mobility between provinces and territories, we can access records. So Panorama is one of the databases. When there was this dream of one database, Panorama was that dream. And we don't use it in Alberta, so I'm not as familiar with the functionality of it. But certainly if there was a way that clinicians could at least see the records, even if they can't directly enter new events into it directly, if there's a way for them to see the records, that would be key. And I'm a bit of a data geek, so I'll say it again. I think really if we can have good records of who's vaccinated and link those to the school records, that's going to be our best chance of keeping track of who's vaccinated and who's not vaccinated.
All right. So another question, some developing countries have conducted mass immunization programs for a few days or a week. Could that be possible in Canadian provinces?
Well, there's challenges with mass campaigns, and the WHO had a guidance document that they put out in May, was it in May? In March, actually, March, shortly after the pandemic was declared. because a lot of certainly lower and middle income countries use mass campaigns a lot for routine vaccines. And they basically said, like, cease and desist for now. Now things have, probably evolved since then, but, their basic message is be very careful about mass campaigns and how you roll them out. And of course, we're going to face some challenges with flu this fall, right? Like because we often do them using a mass campaign. So that's a whole other webinar that you guys could do, is how are we going to do flu? But yeah, mass clinics, especially without an appointment system attached to it, could be a transmission party.
All right. So another person has a question. If there's a vaccine developed for COVID-19, will that be added to the childhood immunization schedule, or will it be delivered on an annual basis?
I guess my answer would be when we find out, I'll let you know. We don't know, of course, if it's what the longevity of a vaccine would be and whether or not we'll need it every year. I mean, certainly the most efficient way, if we do need it every year, the most efficient way would be to find a way to deliver it along with the influenza vaccine. But there have been some regions that have included influenza vaccine within school programs. So when they're doing their fall school immunizations, they do influenza as well. And so, it's possible that that's a way to get COVID into kids' arms as well.
All right, great. So the final question in our Q&A box before we move on to the chat, it's more of a comment, but in Saskatchewan, the public health nurses are not allowed in schools currently. They are bringing students to their health clinics.
Yeah, so now that's, I think, Manitoba before Saskatchewan. I can't remember which province told us it in their interview. So apparently it's not an isolated issue about schools not letting public health in. I mean, I feel like it's something that once we figure out this school thing, if we can figure this out, like right now, every day there's a new message from the school saying, we're going to tweak this a bit. We're going to try something slightly different. I think if we give the schools a chance to sort of catch their breath and get their feet under them, they might be willing to have the conversation again. I think trying to have the conversation to them now when they're still trying to figure out how they're going to do online, in person, quarantine kids, et cetera, I think they're just in overload. So maybe I'd encourage people to not consider no as a hard no, but as a not yet.
All right. So we'll just move back to the chat now. We just finished talking about a school-based immunization in Alberta, and there was another question about any plans for homeschooled and online schooling students being vaccinated.
Yeah, I think we've chatted a bit about that. I mean, the short answer is we haven't heard from any provinces that have that figured out. If I pick up where I think I left off here, there was a good question here about immunization-related fever and whether it'll be confused with COVID symptoms. That's a great question. I mean, we're already thinking about, typically kids go back to school in the fall and everybody comes home with the sniffles, and then all us parents end up with the sniffles. So we're going to have to figure that out. There's going to be when influenza vaccine is delivered, the same thing. If anybody has, a febrile response to that. I think they'll probably need to, there's two ways to go. It's basically if you exhibit any symptom, any new symptom that is a potential COVID symptom, you have to follow whatever the procedure is, get tested, quarantine and whatnot. So there's that sort of hard line approach. I suppose a middle ground might be if the fever occurs in the typical window that's known for that vaccine, then do we say it's probably the vaccine? And I'd hate to be the person trying to manage that process, but I guess that would be the other option. So, let's see. Certainly, there's people asking questions about does anyone else have experience yet with vaccinating in schools? So maybe Antonella, maybe you can jump ahead and just skim and see if anyone in the chat has said, yes, we're in schools and this is what we're doing. I'll just keep going with questions.
Yeah, actually just a quick comment on that, to go back to the schools. It looks like nobody's vaccinating in schools, whereas in Calgary zone, they've been directed to leave the schools until the end of September before they reconnect. And same thing for Central Zone, to delay conversations so that schools can get settled in with their new normals.
Perfect. So it sounds like I wasn't making it up. That's because that's exactly what that's what makes sense, right? You can only challenge people with so many things at one time. So I think that's an excellent approach. There's a great question here about, engaging with teachers in terms of professional development about school immunization. And I think different public health departments have different relationships with the schools. I know other work that I've done, some schools have really tight relationships with public health, and the nurses come in and they do the teaching, or they do co-teaching with the teachers so that the teachers are also on board with it. In other areas, they don't want public health in there and they want the teachers to do the education. So I think, I think if you can get buy-in, it's great to involve the teachers. Again, it's a question of how much more can they take on, though. So Saskatchewan has said here the public health program started the grade 6 and 8 immunizations over the summer, and working for a First Nation, I'm in close contact with provincial public health nurses, and we work together for me to immunize children on reserve doing homeschooling. That's excellent. And I think in some of the remote and rural communities, that may be the approach that needs to happen. Oh, this is a good one. We found it difficult to assess kids when we immunized and they were wearing masks, not able to assess their expressions or change of color in their lips. And gosh, the thing that flashed through my mind is kids who already experience anxiety around immunizations, or lightheadedness around immunization, them sitting there with a mask on, it is going to be a challenge to assess how their child is reacting. So again, I think there's going to be a need to dedicate a lot of resources to do this well, because you can't have kids, the nurse is trying to do the vaccination and the kids, keeling over, and you can't even tell because you can't see their face. That is going to be a challenge. I went to my eye doctor's appointment yesterday, and trying to even get my eyes examined with a mask on when you keep fogging up the visual thing. Has anyone been part of a mobile immunization? So maybe Antonella Routian, you could skim and see if anyone has responded to that question.
Unfortunately, there's no response for that. So I'm assuming that nobody perhaps have close relations or.
Yeah. Okay, and we only just have a couple minutes left. So have you seen any research on the use of social media to positively promote vaccine information and acceptance? I know there's a couple of projects ongoing. I want to say Tim Caulfield, who is, he loves social media. Social media drives me crazy. I think he's doing some work around social media. I wouldn't be surprised if Ev Dubé and or Noni are involved in some work around that. So a short answer is I'm sure there is, but I'm not directly involved. Holly Whitteman is actually, I know she has a project where she's using a lot of graphic communication, so like visuals to communicate about herd immunity and how mask wearing affects transmission and things like that. So she would be a good person to contact about that sort of thing. Like, how do you use a lot of this graphic visualization to communicate some of these concepts? Our province has suggested that public health nurses offer COVID-19 testing for parents who consent when they are in the school doing immunizations. Are you aware of more than one province taking this approach? So just doing like COVID-19, I guess they're saying COVID-19 testing on any consenting child who passes through. I haven't heard of that before. No.
I think that pretty much brings us to the end of the chat. I
Sure.
think there's one more question here. Do you think the demand for influenza vaccine will be higher this fall because of the COVID pandemic?
If we look at Australia as an example, so Australia, of course, is more or less 6 months ahead of us in terms of influenza, and they did see certainly an increase in uptake of and demand for influenza vaccine. And I think a lot of the provinces are upping their order of influenza vaccine, both because they anticipate higher demand and also because they're planning to really promote it. Because again, it's this issue of if you have COVID/influenza symptoms, you know, it's a drain on the healthcare system and the screening and quarantining and whatnot. So shorter answer is we expect there to be higher demand for influenza vaccine.
Okay. And I think we have a comment here for drive-through immunization. So we did a drive-through immunization clinic at one school in the spring to see how it could work. It was well received by the students and parents. It was a beautiful day. Could be concerns if when the weather isn't as nice. There were designated parking spots for the post-immunization waiting. Also some concerns regarding the nurses and body mechanics, but overall the drive-through clinic was well received.
You know, I've read a bit about that, and well done. I did hear about the issue about body mechanics, and you know, it's really important that people wear the right kind of clothes so they can literally get their arm right up there by the window. But I can see how that could be a little hard on the back.
All right.
So
And
I think that's it. I think we got to the end.
yeah, one more comment that just popped up in the Q&A was let us use our skills to calm and to teach and to inform, because there's a lot going on with COVID, and we need to, it's a sentiment of like taking a deep breath. So
it's so true. And I'll just finish with this. I found this great meme on Facebook that I just sent to everybody I knew, and it's that in the time of crisis, when kids are feeling totally overwhelmed with everything, we need to instill our calm in them. They don't need us putting our anxiety onto them. So it was, of course, said much more eloquently in the meme, but it just drove home the point that, and that's true of parents and certainly of healthcare providers. I mean, physicians and nurses, I think our biggest skill is just being able to be calm and reassuring and take control of the situation and just make people feel like they're safe. So I think we have great skills to use.
yeah, I think that's a great way to end it off. And thank you so much again, Dr. MacDonald, for your wonderful presentation, and also for taking part in our new chat / Q&A forum that we were doing. So very much appreciated. And thank you all for joining us on CANVax's and Immunize Canada's webinar today. Just as a reminder, there will be a recording available of this webinar. And if you do have any questions for us, please feel free to send them to us. We'll also be sending an email notifying you about the recording of the webinar. So that's pretty much it. Thank you again, and everybody have a wonderful afternoon and stay safe.